I was in the hospital. I had it, and I got better. And I will tell you that I had something that they gave me, a therapeutic, I guess they would call it. Some people could say it was a cure. But I was in for a short period of time, and I got better very fast, or I wouldn't be here tonight. And now they say I'm immune.
When we heard that, we knew we had to ask our next guest a few questions. So back with us again tonight is Dr. Vin Gupta. He's a critical care doc specializing in these kinds of illnesses, also an affiliate assistant professor out at the University of Washington Institute for Health Metrics and Evaluation. So, Doc, there were many quotes from the president tonight about this virus. Quote, "It will go away." Quote, "We're rounding the corner." Quote, "It is going away, and we're learning to live with it." You heard him declare his own immunity. You heard him declare therapeutics a cure in his wording. Please have at what you heard from the stage tonight.
Good evening, Brian. Good to see you. A lot of things that need strong clarification. I'll begin by saying there is no cure or high quality personal protective wear for the people. There just simply is not. Let's be clear on that, because there's a lot that was said that's going to lower our guard as Americans as we enter a really dangerous phase, a dark winter, according to the former vice president. I hate to say, but that is a concern amongst all of us in public health, clinicians as well. So there is no cure. There is no high quality PPE. Teachers, parents are desperate for that high quality PPE. They don't have access to it. Only the chosen few have access to it. So that's number one. We're not rounding the corner. To say that is ignoring ICU surges in South Dakota, where the Society for Critical Care Medicine actually asked for volunteers, respiratory therapists, nurses, and docs to descend on South Dakota to help out. Same thing happening in Wisconsin, Utah, Ohio. Highest hospitalization rates in the entire pandemic happening right now. Also happening in 16 other states, mind you. 39 states seeing increases in hospitalizations. So we're not rounding the corner. Number three, I think it's important to say this because we trust him so much. Dr. Fauci, and the president unfortunately continues to say this, Dr. Fauci never said not to wear a mask. In the very beginning of this, he basically said, we don't have enough N95 masks, and one could point the direct line at the president and not invoking the Defense Production Act as responsible for that. Dr. Fauci basically said, please be careful with mask usage because we need it for our frontline healthcare workers. So that's really important to clarify. And number four, I would say the China ban is this crutch that the administration keeps talking about. But the American people deserve to know that the China ban didn't work. That was not part of a pandemic strategy, Brian. 400,000 Americans came to the country after the ban was implemented. It is not a pandemic response strategy. And I think that's really critical to know.
And indeed, the president used his own case and that of his son, both recovered as far as we can tell, and we're happy for that, as part of his argument, Doctor.
And, to that point, Brian, recovery is important. Immunity is important. The president now goes on and talks endlessly about immunity. And let's be clear to the American public. We do not know how long immunity lasts after you've been naturally exposed, Brian. We just don't know the answer to that question. There was a case of a 25-year-old gentleman, otherwise healthy in Nevada, got a reinfection 5 weeks after his initial infection. And that reinfection, by the way, was more severe symptoms than the first time. Sort of threw us for a loop here in public health because we thought it was actually going to be less severe the second time based on what we've learned from reinfection across the world. So the president should not be going on air in these presidential debates suggesting to the American people that if you've got it once, you're good. That's not true.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.